The goal of this type of prosthetic solution is denture stabilization and removal of at least part of the palatal coverage. Let's remove the first healing cap and seat the first O-ring abutment. The transmucosal abutment portion must surmount the gingiva and avoid the housing compressing the soft tissue. Also, the second one is fine. Let's try also the other two abutments. During the last visit, I selected with the plastic try-in abutments the most appropriate abutments as for height and inclination. All of the abutments appear to fit perfectly. Now we can activate the Morse taper connection with the abutment using the specific abutment beater. At this point, we have to further relieve the denture to create space for the housings. Let's seat the housings on the abutments to check how much space we need. We have to obtain a perfect tissue-borne denture without any friction on the abutments. Once we have created enough space, we are ready to attach the housing to the denture. We place a rubber dam above the shoulder of the abutments to prevent acrylic from locking into the abutments. I create little holes in the rubber dam and push it over the O ball heads. We seat the housings back on the abutments and verify again the correct fit of the overdenture. We have to feel that the denture clasps on the soft tissue. Here you can see the inner part of the denture. We apply adhesive to the appropriate areas where the acrylic will bond, and then protect the teeth and buccal flange with Vaseline. Then we ask our assistant to prepare a flowable acrylic. We place or inject the acrylic into the relieved portions of the denture. I recommend you fill completely the housing, seating in the overdenture with the acrylic in order to allow the correct bonding of the housing to the denture. After having injected the acrylic also on the housing, we place the denture into the mouth, check again the occlusion, and instruct the patient to close the mouth tightly, but without excessive force. If you have created a new denture, check that it stays in the mouth also without implant interference. Deliver it at the beginning without housings placed to the patient so that the tissue can be correctly conditioned, and only afterwards bond the housings to the denture. Once the polymerization process of the acrylic is over, we take the denture out of the mouth, remove the rubber dam, and polish carefully the excess acrylic around the housings.